So Dr. Gaborek, tell us a little bit about what you do.
I'm a board-certified general and vascular surgeon. Majority of my practice is specializing in vascular diseases, arteries and veins, etc. Of course, working for McLaren Macomb. Also, program director of the general surgical residency as well. Very excited about the recent opening of our new vein center just down the road from here. Long overdue.
Tell us a little bit about veins. I know it's something that haunts many women, varicose veins in particular. You know, tell us, you know, what is it and how can we avoid them?
Yeah, veins. Well, something that I've been interested in for many, many years. You know, early on, vein disease was sort of like the quote-unquote redheaded stepchild of abnormalities or disease states because in general, you know, really before 2000, it was treated medically with large amounts of compression, wraps, etc. Those patients were lifelong patients of physicians, and the procedures that we had back in the day were quite aggressive and led to prolonged healing times, downtime for individuals, and quite significant to that patient as far as comorbidity after the surgeries. And then around 2000, early 2000s, the introduction of less invasive procedures was undertaken. And that really has evolved up into today, to where the majority of vein disease treatment strategies is around minimally invasive procedures. Typically, when I talk with patients, I think the best thing, if not all, the main thing is education. What are veins?
Now, should people be concerned about the veins when they start to protrude and become really visible through the legs? Is it a chronic situation? Or?
Yeah, just to extend that on, what are veins? And that's probably one of the very first questions I ask my patients. Just as I'm asking you, I say to them, what is a vein? I always forget. What do veins do again?
Good.
Because arteries and veins are commonly back and forth. Patients use them as if they're the same thing. And I always tell them, no, let's think about what we're talking about. Veins take blood back to our heart. And so most commonly in our legs, that's what we're talking about. If we think about it, veins are taking blood back to the heart pretty much against gravity throughout the whole day. And so for many different reasons, these veins can become abnormal in their function or diseased as we talk about it. What keeps the blood moving one direction in veins are valves, and most commonly people have valve abnormalities where their valves simply tire out, and that can occur for many reasons. It can occur just from us living. Age over 50 is one of the biggest risk factors for developing poor vein function or poor valves or leaky valves. Being a woman, women with 2 or more pregnancies have a higher risk. Prior injury, blood clots is a big thing. Prior surgeries on the legs, etc. Family history of vein disease as well. Those are really the big risk factors that I tell patients. Now, people are always coming to me with the symptoms. So if we think about veins and what they do, take blood back to the heart, and if those veins aren't working well, then that means that we are not returning the blood back to the heart from our legs. Well, where is that blood or that volume staying? It's staying in our legs. Well, what can happen then? And those are really the symptoms. If we're not returning that blood volume and that fluid back to our heart, then our legs are going to withhold that fluid. And so swelling is a very common symptom. Swelling where? Well, it can be all within your tissue, or it can be within the veins themselves. Swelling in a big vein by the skin, we call that varicosities, right? And then people can have all different types of symptoms of that. Varicose veins are the largest veins. Smaller veins, they can look like a big bruise. We call those telangiectasias, or the dark purple ones. Those are called reticular veins, etc. Those are all signs, and then the symptoms of leg swelling or achiness, or your legs feeling heavy throughout the day, are the most common signs and symptoms of having poor blood return or poor vein function. It can proceed.
Let me ask a question.
Oh, go ahead.
So the people who are at risk, you said women, women after pregnancy.
Sure.
You know, and you named a few others that are just very common and broad. Like,
Oh,
so
definitely.
what would women or women who have children or some of the other people that are at greater risk do to avoid it? Like, is there a way to what kind of things can they do to keep their veins healthy?
Tongue in cheek, I always tell my patients, and then when they ask me that similar question, well, what can I do now to not have any other vein problems? I say, well, we'll stop time.
Okay.
You know, we will no longer age, because age is the biggest risk factor.
Okay.
And if you can imagine, as we get older, things start to wear down. And so most of the things you can't avoid, you can't do. Now, some of the risk factors that we have are prolonged immobility, you know, where we're not exercising, et cetera. And then other things like prolonged standing or sitting in this position can increase your risk as well. But the majority of time, the causes of vein disease or progression or chronic vein insufficiency, which is really like the umbrella term to all these signs and symptoms, occurs somewhat naturally throughout our life. The majority, I guess it's estimated about 30% of all adult Americans have some isolated form of vein dysfunction or disease at any time, and it progresses every decade after age 50. So most of the time, with
Does
my
working
patients,
out or anything like that help?
well, working out, just walking, really, the vein's job is to return blood back to the heart. And by walking and being active, it really reduces the pressure within the veins as long as your valves are competent or functioning well. The veins do a great job at doing that. It's whenever these valves become incompetent is when we start having increasing stagnation of blood or poor blood return. And that's where our therapy really starts, where I'm sure you've seen or know people that wear those compression stockings. That's where those are instituted. The stockings, again, don't do anything to make your veins better. What we're trying to do is alleviate the symptoms or slow down progression of vein disease. So that's number one.
And at what stage in a person's life would it be advised for them to see a vascular surgeon?
Right. What's interesting about vein disease is it goes hand in hand with how we get older. And so most of the time, I'm no different. You know, as we get older, we just can't seem to, we get tired a little bit easier, or, oh, my legs are hurting throughout the day. And we, a lot of times, shrug that off as being, oh, I'm just older, I'm not as fit as I used to be. Any sign or symptom of anything, that be veins or anything like that, but any sign or symptoms of leg swelling is key. Skin changes, any varicosity or blemish, or aching, tired legs that are sort of prohibiting you from doing what you want to do. That's the classic signs and symptoms of what brings patients to me. Understanding, I guess, or that education of understanding what veins do and the risk factors really then can be suited for each individual.
And you really got to listen to your body.
Oh, definitely.
You know, like you were saying, people chalk things up as, oh, I'm over 50, I'm over 40, so I'm slowing down. But listen to your body, follow through, and check it out.
Keep regular doctor visits with your primary care physicians. That's an excellent way to keep attuned, because with a regular and thorough physical exam that we should be getting every year, you know, your physicians, your primary care physician should be able to isolate that, or at least educate you and direct you, at least to me, if you want, should you have those or need second opinions.
Tell us about the new center that's opening.
I'm very happy, and it's almost like finally. It allows us the ability, I believe, to be more complete and comprehensive in our care. I see a lot of patients who have had multiple vein procedures in the past, and that's one of the very first questions I ask them. What does a vein do again? And whether they fail to recall, et cetera. I think more often than not, I know with vein disease, now that it's becoming more minimally invasive, many more people are doing it. And that's sort of how the evolution has occurred. And I think with me, internally, I want to make sure with every patient that I see that it's individualized. Every person is not the same. Every expression of vein abnormality is not the same. And what works for one person isn't the necessary treatment strategy for all. And so it starts with that baseline assessment, discussion with the patient, the education, and then setting a goal. A goal for a young lady in her 30s may be totally, and usually is totally different than a gentleman who's 75.
Makes sense.
And so when we have goals that are discussed, then our outcomes are always going to be better. And when you know with the Vein Center that you're going to be provided with state-of-the-art care by board-certified vascular surgeons, I believe that allows us to treat patients comprehensively, all comers, whether that be the smallest of spider veins, where they're looking for more of a smaller, minimally invasive procedure, cosmetic procedure, all the way to we see a large number of patients who have had blood clots in their legs. And those blood clots, if you can imagine, are obstructions to the veins. And now they have the sequela of having that obstruction where they have skin changes or wounds that they're dealing with much more severe than the small little blemishes. And those patients at the Vein Center, now we can provide them with care, and those are the ones that we will be doing at the hospital.
I think that's great. I mean, something that is potentially inevitable, like you mentioned, with age.
Right.
And now people having a location where you can be serviced and don't have to bop around from office to office and get everything done in one place sounds fantastic.
Well, thank you.
Yeah.
No, I'm excited, and the key word I think is comprehensive, and so there is not anything that we can't do with that mix of both as an outpatient setting in a vein center, as well as the most invasive or aggressive type of vein procedures for some individuals that we see, especially those with blood clots, where we're taking them to the hospital and back and forth. I think it's a perfect handshake of the two.
Dr. Gaborek, I really appreciate the conversation. I think it was great. And good luck with the Vein Center.
Thank you.
And we appreciate you being here today.
I really appreciate this opportunity, too.
Okay.
For more information, visit mclaren.org/Macomb Vein Assess.